Bismillahirrahmanirrahim. My name is Dr. Amber Arshad, and today my topic of presentation is obesity under supervision of Professor Dr. Shahir Afzal. In this presentation, I shall be explaining the introduction, the WHO facts, causes, complication of obesity, nutritional transition, prevention, recent updates, and an MCQ session at the end. At the end of the presentation, the participants will be able to describe the causes, complications, and preventive strategies for obesity. So what is overweight and obesity? It is actually an abnormal and excessive fat accumulation that impairs health. So worldwide obesity has tripled since the 1975 eras, and 2016 there was 1.9 billion adults. Until 2000 and in the same year there were 39% adults aged 18 or over that were overweight. By the end of 2020, 39 million children under 5 years of age were overweight and obese worldwide. But still, it is considered that obesity is preventable. This is an area map that is given by WHO regarding the different areas in different prevalences of obesity among adults. And you can see that Pakistan lies in this orange zone of obesity. And the red area shows the very high prevalences of obesity among the general population. This was the data that was taken from the UNICEF WHO joint malnutrition estimates, and it showed that the percentage of children under 5 affected by stunting, wasting, and overweight global from 2000 to 2020. However, it has decreased, the graph has declined, but still the prevalences was reported high. And similarly, the number of children affected by in millions, they were also very high. For Pakistan, the national obesity risk from the Global Obesity Observatory shows that it is 6.5 out of 10, and the childhood obesity risk is 5 by 11. And you can easily see that women have a higher risk of having obesity than the men and children. This is a graph that is taken from an article recently published showing that underweight, short stature, overweight, obese percentages among the adolescent boys and girls, and short stature is most prevalent and along with overweight and underweight and obese. So what are the causes of obesity and overweight? The fundamental cause of obesity and overweight is an energy imbalance. Globally, there has been an increased intake of energy dense food, that is the carbohydrate rich food, and high fat and sugars, and low protein diets and healthy fats. So an increased physical inactivity due to an increasingly sedentary nature of many forms of work, changing modes of transportation, and increasing urbanization has been considered a earlier cause for this disease. What are the common health consequences? They are the non-communicable diseases such as cardiovascular diseases, diabetes, especially type 2 diabetes, and now the type 1 diabetes mellitus in children of young age, musculoskeletal disorders, cancers, and risks. So the childhood obesity is associated with higher chances of obesity, premature death, and disability. But in addition, there is an increased risk of obese children experiencing breathing difficulties, hypertension, and early insulin resistance leading to diabetes mellitus. So overall, the complications nowadays is the topmost that are being reported is with type 2 diabetes, mellitus, strokes, and heart diseases. Other than that, there are digestive problems, sleep apneas, orthotitis, and there were also reported severe COVID-19 symptoms when the pandemic was cases were being reported. So so the lower and the middle income countries are actually facing a double burden of malnutrition. While these countries deal with the problem of infectious diseases and undernutrition, they are also experiencing an upsurge of non-communicable diseases like obesity, overweight, especially in the urban settings. Children in lower and middle income countries are vulnerable to inadequate prenatal, infant, and young child nutrition. So therefore, these children are exposed to high fat, high sugar, high salt, energy dense diets that cost slower but are lower in nutrients as well, causing the different types of malnutrition in children under 5 years of age. So dietary patterns along with the physical activities leading to undernutrition as well as overnutrition of the children. There has been a nutritional transition, and it was during with 5 stages. There was a hunter gatherer stage, there was modern agriculture and famine, receding famine, there was a degenerative disease, and the behavioral change. Then there were the phases for the urbanization and economic growth, changes with the work, leisure, and food processing. The phase one started with plethoric man hunter gatherers. Settlement begins with non culture period. The third was industrialization, the fourth was non communicable disease, and the fifth was desired societal behavioral change. The term nutrition transition is commonly used by researchers, and it is actually a shift from the stage 3 to stage 4, meaning that change away from traditional diets towards foods higher in fats, meats, and sugars, and the rise in sedentary lifestyles as countries become more industrialized. And currently, most low and middle income countries, including Pakistan, have been moving from pattern 3 to pattern 4. This shift from traditional diets to Western style diets have been a key contributor for the obesity in low and middle income countries like Pakistan. So how can we reduce obesity? Obesity is all related to the non-communicable diseases and supportive environment and communities and fundamentals in shaping people's choices, like physical activity, healthier foods, the choices they make, and can prevent the overweight and obesity. There is also a big role of food industry that is playing a role in giving us food that causes obesity in all age groups. Like food industry plays a significant role re- um, and can also they can promote the healthier diets by reducing fat, sugar, and salt content and ensuring the healthy and the nutritious choices, restricting marketing of foods and ensuring availability of healthy food choices. There was a WHO response that all started in 2004 and was recognized again in 2011, Political Declaration on Non-Communicable Disease, under the WHO Global Strategy on Diet and Physical Activity and Health. There is a 2030 agenda for SDGs of non-communicable diseases as a major challenge for the sustainability. And world over, this national responses they are ambitious to achieve the agenda, the targets, and to reduce one-third premature mortality from NCDs by prevention and treatment. There is also a global action plan on physical activity, and it is 2018 and 2030. So WHO published active a technical package to assist the countries in planning and delivering, and new WHO guidelines on physical activity, sedentary behavior, sleep in children under 5 years has been launched in 2019. Strategies to prevent and manage obesity. There is no single or simple solution. So, policymakers, state, local organizations, business and community leaders, schools, childcare, healthcare professionals must work together. And there are several ways where we can support the environment for healthy behaviors to prevent obesity. For primary prevention, the state and the local programs plays an important role. Knowing your body mass index, achieving and maintaining healthy weight, getting regular physical activities can take yourself to combat obesity. Community efforts focus on supporting healthy eating and active living in a variety of settings, like learn about how to have an early childhood care, hospital, schools, and food service venues. So, healthy living overall includes assessing your weight through BMI and waist circumference. That are the two screening tools that are mostly used to estimate the potential risk. Healthy weight, a high BMI can be an indicator of high body fatness. Visits the healthy weight website and learn about the balancing calories at as most websites can give you diet charts, balanced diets, and how to control your calorie requirement and your weight. There is a Choose My Plate app or a website that gives you an information on food and track your calories and plan your meals. And your weight loss program should aim slow and steady loss. And if you plan to lose more weight than 15 to 20 pounds, they have any healthy problems or taking regular, then discuss your plan with the healthcare providers. And it's better to control your calories and discuss it before going on to a strict weight loss regime. And the physical activity should be basis that most experts says that you have to work every day for six up from 30 to 60 minutes, moderate activity daily to lose weight. But nowadays you don't have to do 30 or 60 minutes all the time. You can vary your physical activity up to 30 minutes every other day for a week. So, tips for the parents is also that the seriousness of childhood obesity and how to help your child establish behavior. So, parent counseling and parent education is also important. So, for the secondary prevention, a body mass index is a simplest index with weight for height that commonly used to assess this obesity. And as you all know that it is weight in kilograms divided by height in meter squares. And BMI provides the most useful population level measure of overweight and obesity in all genders and of all ages. However, it should be considered a rough guide because it may be correspond to some degree of fatness in different individuals. We all know that there has been set levels by WHO like overweight is more BMI equal than or more than 25 and obesity is more than greater than or equal to 30 and morbid obesity is more than 40 BMI. For children under 5 years of age, we use overweight for height for age greater than 2 standard deviations and obesity weight or height greater than 3 standard deviations on the growth charts. And for the children under between 5 to 19 years of age, there is BMI greater than 1 standard deviation above WHO is overweight and obesity greater than 2 standard deviations above the WHO is reference. From the reference median is obesity. So generally there are treatments like healthy eating plans, regular physical activities, changing your habits, weight management programs, weight loss medicines, weight loss devices. Bariatric surgery is nowadays very popular that bypasses the digestive system and shortens the whole length of and reduces your capacity to eat, and special diets that includes the keto diets nowadays very popular in our community. And for the tertiary prevention, there is rehabilitation. The general objective of rehabilitation is helping obese people achieve realistic and healthy weight loss, promote adherence to healthy and active lifestyles, and teach how to manage the diet by learning the calculation of the calories. So, what are the challenges that are faced by Pakistan? Recently, this report was published and it shows that 40% of the children in Pakistan suffers from obesity. It is from the Karachi, a colossal 40% of children in Pakistan are either overweight or obese, mainly due to sedentary lifestyle, excessive screen time, and a high unhealthy diet. And the latest studies and health experts says that according to most recent studies by the state-run Pakistan Health Commission, that was in 2018, over 11% children were overweight and more than 5% children were obese. But these were the recent figures. Now, only in one city, the percentage has risen up to 40% for Pakistan. This was also taken from another article of perceived barriers to the treatment of this condition, like poor health and literacy, lack of financial assistance, high cost of out-of-pocket payments, food industry influence, obesity is not recognized as a disease yet, lack of training for healthcare professionals, poor adherence or fear of treatment, and lack of advice, monitoring, and research. There is also a document that has been recently published that was the engagement plan for SAP Pakistan crisis resistant social protection and it showed the roles of stakeholders for controlling the obesity problem in Pakistan. So obesity was not yet considered as a disease by government, but healthcare providers and the people should work in collaboration to overcome this problem along with the government. So there were calls for more public awareness campaigns. Stakeholders reported that the lack of obesity management and treatment guidelines in Pakistan are the main cause. And there has been an agreement that individuals become eligible for pharmacological treatment when BMI is greater than 30 kg per meter square. So, as a result of people living with obesity in rural areas were said to not enter the health systems of care, compounded by the fact that those in rural areas are also less likely to consider obesity as a disease. And there is no specialist obesity training available in Pakistan. So stakeholders reported that a lot of treatment in delivered by quacks in rural areas, and the issues of quacks is not isolated to obesity treatment. So some of the recent updates. This was a paper that was published with title Glycemic Status and General Characteristics Among Individuals with Undiagnosed Diabetes. And this was findings from a national diabetes survey showing that among all individuals, 23.7 were found to be less than 40 years. This was the age, but a significant number of people remain undiagnosed, and it was related to the obesity, dyslipidemias, diabetes, and 80.8 for abdominal obese. And so obesity was more prevalent in people with these having either diagnosed or undiagnosed diabetes, and later on the hypertensives and dyslipidemics. They were also very highly prevalent. So alarming, the glycemic status along with other associated risk factors at the time of is alarming, and thus early detection of diabetes and awareness educations must be there along with the obesity status of the patient. Second is the current prevalence of underweight, overweight, obesity associated with demographic factors among Pakistan's school-age children and adolescents. And school-age children and adolescents, the prevalence was between for underweight, normal weight, overweight, obesity was ranging between these levels, and it was 5.8 for overweight and 5.4 for obesity. This study was done in one of the specified area of Pakistan, and it showed that urban areas were likely to be underweight, overweight, or obese than the rural areas, and accordingly, more boys than girls were affected. So, in Pakistan, school-age children and adolescents, underweight, obesity were prevalent compared to the studies from previous studies from 2011. The risk of overweight or obesity has decreased, but still the number are higher. Prevalence and determinants of nutritional status among women and children. This also showed that there was main risk for poor nutritional status includes low household wealth, urban residence, and mother education. And all these factors led to the poor nutrition and malnutrition in children, or or women having low education status, not knowing how to balance the diet of their children. So they are facing many kinds of problems. So the obesity pandemic, whose responsibility? No blame, no shame. So to change the environment from obesogenic to leptogenic requires government. Intervention should be age appropriate, and social media with role models, influencers, sports, and pop stars should all be having advertising the campaigns. The health and political correct messages are often to odds. Slogans from the body positive actives like fat is beautiful or proud to be fat should be replaced. And addressing and avoiding stigmatization, especially in media and social networks, are major challenges in maintaining and dealing the patient with obesity. So now it's time for the MCQs. MCQ number 1 is, how does a person who is classified as obese differs from a person who is classified as overweight? So an obese person has maintained a BMI above 25 for more than a year, while an overweight person has maintained a BMI over 18.5 for 6 months. Or a person is considered obese if they are 50 pounds of their ideal weight, while the overweight is less fit than 50 pounds. Or an obese person is at risk of diabetes and heart disease, and an overweight person is not. Or a person is considered obese if there is BMI 30 to 39, while a person is considered overweight if the BMI is 25 to 29.9. And the last option is, a person is considered obese if a person has maintained BMI less than 18.5 for 6 months. So, any idea?
D.
Yes, D is the right answer. This is the right range for differentiating between obese and overweight. Studies suggest that there has been a nutrition transition to be in the stage where the society realizes their energy dense diets and sedentary lifestyles are problematic, giving to the non-communicable diseases and a reduced quality of life from chronic diseases. Which type stage is this in which we face these kinds of problems of non-communicable diseases and chronic diseases? Either it's stage 1, stage 2 of famine, stage 3 of receding famine, stage 4 degenerative diseases, or stage 5 behavioral modification.
D.
D is the right answer. Degenerative stage of degenerative disease, as most of the lower and middle income countries have started transition from stage 3 to stage 4, but most of the developed countries have now progressed in stage 5 with behavioral modification, where they are promoting healthier lifestyle and healthy diets. With increased industrialization, the nutritional pattern had drastically shifted. And the last stage of nutritional transition focuses on behavioral modification. Uh, about behavioral modification for childhood obesity, which of these following is excluded from the desirable behavioral change strategies? The reinforcement through contracts, praise, rewards, including food items, setting, achieving weight maintenance and weight loss goals, teaching skills for weight loss, providing latest gadgets for weight loss, and educating parents and children on needs for their lifestyle. Which strategy is discouraged for transition from stage 4 to stage 5 of better healthy living?
D.
Is the right answer. Reinforcement through contracts, praise, and rewards is discouraged because it can lead to um, unhealthy eating habit behaviors. Mr. Rahim, along with her wife, came to a counseling center with some ambiguities regarding weight of newborn baby. On inquiring, the doctor finds that both strongly believe that their child would be obese too. The doctors must tell them that among the following traits, Dash plays the greatest role in the potential for the obesity: lifestyle, gender, heredity, age, economy. Any idea?
Alpha.
Yes, it is the lifestyle that majorly plays the greatest role in the potential for the obesity. It's not the any other like it's a heredity trait or something. It's the life. It's all based on lifestyle. If the parents are obese and they feel that their children will also have an will be obese, then it all depends on the lifestyle after they are born. Body weight tends to fluctuate and it depends on food you're eating and hormones you're taking and how much water you're taking. So, how much physical activity you aim for each week to help your weight loss, that is not um, um, extensive and out of your range, which is normal exercise or normal daily routine. 20 minutes on most days, 30 minutes on most days, 40 45 minutes each week,
E.
45 minutes. Yes, B is the right answer. It's 30 minutes on most days by the recent guidelines. A 35-year-old female visited her doctor for her follow-up after following strict diet plan recommended by him. Which of these serious health problems has been linked to obesity nowadays in people who are very much concerned to their BMIs and their diets and their body weights? Either it's type 2 diabetes, it's liver disease, kidney disease, it's viral disease, or gastroesophageal reflux disease.
A.
Alpha.
Yes, type 2 diabetes. Recent studies have shown that the people having weight issues are being diagnosed with this type 2 diabetes and even type 1 diabetes. Teacher assigned a group of students to investigate the problem causes of increasing obesity prevalence. After extensive literature search of students concluded that the main cause of obesity epidemic was one of the following. Which of the following is best option that causes is that is suggested as the main cause of obesity epidemic nowadays? Increased energy quantity, density, and more sedentary lifestyle, changes in genetic profile, decreased leisure time activity, use of medication and surgical procedures, or more affordability to more advanced gadgets.
Alpha. C.
Mm. Sorry, can you please speak again?
C.
Alpha.
No, C is not the right answer. It's A. The main issue that is being faced is the increased energy quantity and density and the more sedentary lifestyles that are contributing to this obesity epidemic. A 45-year-old obese male who is way overweight presented to the nutrition clinic for a diet plan. He is passionate to lose weight and willing to do extensive exercise. A healthy weight loss strategy for such patients should emphasize all other than which of the following: an exercise program, a high protein, low carb diet, a reduced calorie diet that has high in complex carbohydrates and low in fat, behavior modification aimed, and 30 minutes walk every other day in a week.
Beta.
Delta.
Actually,
A.
Charlie is the right answer. High carbohydrate diets and low in fat with reduced calorie is not the part of that strategy. You have to always have to take low carb and high protein in a balanced form. This will also lead to the weight loss, not weight gain, if you are getting it under with calculated calories. Discussing weight with clients may seem awkward, but with training and practice, it makes easier. Studies have shown that talking about weight helps to promote behavior. Based on the known facts, the weight gain is mostly influenced by which of the following? Weight gain. Eating a large quantity of food just before bed, your total daily caloric intake, eating most of your daily calories before noon, our attitude or demeanor while eating, behavior modification aimed to changing bad eating habits. Weight gain.
B.
Alpha.
Actually, it is the I have in the previous it was also the calories and now it's also the calories. So it's the total caloric intake that is nowadays more important. How much you are taking and how balanced the diet you are taking. So B is the right answer. And the last is due to the increasing burden of obesity worldwide, planning new policies and strategies is must. With regard to reducing the burden of disease associated with obesity, which of the following is the key goal for designing such a strategy? Patient pledging they will act, reducing the number of severe obese by bariatric surgery, health literacy on obese, self-help with choosing healthier foods, intermittent fasting or calorie diet in high complex carbohydrate and low fat.
C.
Charlie.
C is the right answer. Health literacy on obesity,
Charlie.
self-help with choosing healthier foods is the right answer. This is the key. These are some of the supplementary material. And thank you. And there is a YouTube link. Kindly subscribe.
Okay, thank you very much, Dr. Amber. Again, a very good time management and beautifully presented on a very important topic, obesity. And as we know that obesity, it is being called now as an epidemic, and many people who are being suffering from obesity, they are also at the risk of chronic diseases like diabetes and cancers. And this cell growth that is being unchecked, and it also lead to certain hormonal productions and hormonal problems, including polycystic ovarian disease, and the fats that are being deposited on the liver are leading to the fatty liver disease. As we know that in Pakistan, really we are struggling with viruses, and in most of the developed countries, the first and topmost cause of cirrhosis of liver, it is the fatty liver disease. Many people who are being transplanted for fatty liver, they are getting good diet, minerals in order to keep a healthy weight, and that is the foremost important thing. We know there are certain dietary guidelines that how much fat should be included in our diet. However, it is a consensus that the fat should make up of 20 to 30% of our total daily calorie intake. As you have already emphasized that the total daily calorie intake, that is more important. It is not only the diet and the timings of the diet, but the total daily calorie intake that is consumed per day, and to have the essential fatty acids, essential amino acids in the diet, that all are for healthy individuals. It is again very important to emphasize that the total fat that is present in the body, it is being checked by certain important investigations, and it has been found that there are certain ages and they are correlated very well with the percentage of the fat in their total body weight. So now the emphasis has been changed from BMI and from the weight to the total body fat that is being present. And in men, we know that it is lesser a percentage of the total body fat that is there. However, in women, there are more towards having greater percentages. So the men that are less than 40 years of age, they must have from 8 to 19% of their body fat, while in from 40 to 59, it can be increased up to 23%. And after 60 years, it is from 24 to 35% of body fat. While in women, as we know that they have a higher body fat percentage than men, so their values are from 40 to 59, women must have 23 to 33%, while from 60 to 79, women should have 24% to 35% of body fat. So it is healthy. And if someone is attempting to lose body fat, again 0.5 to 1 gram per kilogram is the recommended amount that he or she can lose per week. So these are the important things that I must emphasize, that they should also be added about the total body fat content, and how the men and women, they are different, and how the different age groups, they are different, and now the total calorie intake, that is given more importance rather than only the total weight of any person, and even the BMI. It is being correlated in certain guidelines like ATP guidelines and WHO guidelines for metabolic syndrome, but the more emphasis is on total calorie intake. So these are my few inputs in this presentation. Very well done, Dr. Amber. And your presentation is always given us a food for thought and a lot of learning material, so that we can all learn from each other. Thank you so much. Allah Hafiz.
Thank you,
Thank you,
ma'am.
ma'am.
Allah Hafiz.